Hello and welcome to Early Bird by Amerisleep. My name is Dr. Devon Hoffman, and today we're going over sciatica pain and sleep, and we've done the research so you don't have to. Now, to give you guys a brief overview of sciatica, a lot of you might be dealing with this, and it's one of those symptoms that comes along with a lot of different conditions. Sciatica is more or less defined as pain that radiates down the leg, typically coming from the hip or low back. It can cause a lot of symptoms like muscle weakness, numbness, tingling, and pain, going all the way potentially into the big toe from the hip or low back. Now, to start off, let's go over some of the causes of sciatica pain. Now, a lot of this pain can come from the low back. Potentially your nerve here could be getting pinched, you could have a disc protrusion, or you could have some sort of inflammation around the facets of your low back that would basically compress the nerve and cause neural irritation that moves down from the low back into the hip and down the leg, causing pain, numbness, tingling, etc. Now, another cause could potentially be the hip. So muscles like the piriformis can cross over or under or through the sciatic nerve, causing pressure and pain in this nerve and radiating symptoms down the leg. Now, potentially a final cause that we see in the clinic is neural irritation that comes from nerve tension. The sciatic nerve is basically one long string that goes from your low back all the way toward your toe. The nerves together all the way are one contuitive piece that basically, if stretched or irritated, can be very painful to stretch, meaning that when you move your body, if the nerve feels any sort of tension, it will send these radiating pains or zings down the leg that can be very bothersome, and that's kind of what we would diagnose as a neural tension type of sciatica. Now, looking into treatments, there's a variety of treatments, as this is one of the most common symptoms that people have. Roughly 80 to 85% of people will have low back pain in their time, and a good portion of these are sciatica type low back pain. Now, the number one fix that we see and recommend all the time in the clinic is consistent movement of the low back and hip throughout the day. Now, this does have to do with things like poor posture. This does have to do with taking breaks, not sitting for too long, and consistent exercise. All of these very hard to implement, but very easy to grasp concepts for how you can relieve low back pain and sciatica symptoms. We usually recommend every 20 minutes to an hour, take a couple minutes, do a little bit of walking if you are a sitting type of worker, and this can greatly help to relieve sciatica symptoms. Now, other options, if you are looking to consult your primary care provider, they could provide anti-inflammatory or pain relievers, which can help give you a little bit of a boost in the short term, or options such as cortisone injections or other injection type therapy that can help relieve some of the irritation in this nerve. Now, lastly, as a doctor of physical therapy, of course, I like to back all of these up with a proper exercise and stretching routine that is individualized to your type of sciatica symptoms. Now, a lot of these exercises and stretches could be right for you, but it depends on what type of sciatica type of pain that you have. Like we discussed earlier, they're very different and they can come from different sources. So it's important to get a full evaluation from a local or virtual physical therapist to help figure out what your type is and design a plan of care for you. Now, if you are looking to prevent sciatica pain, doing sciatica-based stretches and exercises can help relieve this sort of tension or prevent it in the future. Taking consistent walking breaks, not sitting too long, and maintaining good posture in your low back and hips can all be crucial in preventing this issue from ever coming in the first place. Some frequently asked questions we're going to dive into today about sciatica pain. Does this mean that my nerve is damaged, and do I need surgery? So in most cases, the sciatic nerve is merely irritated rather than damaged. The nerve is very robust and does not damage very easily. However, if it is a very severe case, this can be irritated to the point where it is helpful to get some sort of injection or intervention to relieve this sort of pain that might not relieve on its own with stretching or recovery. I've had previous back surgery. Can stretches and exercises really help? Now, for a lot of people that have had back fusions or laminectomies or various back surgeries, this is very common to sometimes get symptoms that can go down the leg after or years later after you've already recovered. Now, this necessarily does not mean that you need another surgery to fix it. It might just mean that you lost some more mobility since the time of surgery, or you irritated the nerve with some recent activities. So making sure to modulate those activities or seek some conservative treatments to see if you can avoid surgery again or to prevent it from coming back after you have already had surgery. Now, another way to prevent low back pain is to get proper sleep and proper alignment during your sleep. So relieving low back pain with proper positioning, like our other low back pain videos, can be crucial in preventing this sort of issue from ever coming in the first place. And if you do have pain, putting a pillow below the knees, sleeping on your back, other things like this that we talked about in previous videos can be a great way to relieve discomfort and overall help relieve low back pain. Now, some of the mattresses from Amerisleep do provide different firmnesses that can be awesome in providing support and proper alignment in that lumbar spine, which can greatly relieve these sort of symptoms. If the symptoms do become severe, do make sure to consult your primary care provider for some treatment options that they may have for you. I hope this info was helpful to help you get the best sleep of your life. Sleep well and take care, guys.